The Ministry of Health has revealed that its plan to administer the COVID-19 vaccine to the populace will be done in 3 phases. The first phase will be focused on vaccinating members classified as vulnerable, such as government officials, healthcare workers, the elderly 60 years and over, members of the Jamaica Constabulary Force JCF, and members of the Jamaica Defense Force JDF. Permanent Secretary in the Health Ministry, Dunstan Bryan, says the ministry will administer the first dose of the vaccine in March.
We start with our government officials, then our healthcare workers, then we move to the Jamaica Defense Force and the Jamaica Constabulary Force. In April, we begin the vaccination for the elderly, the Jamaica Fire Brigade. We begin the vaccination of schools, Department of Correctional Services, and PICA, the Passport and Immigration Citizenship Agency. We give our first dose in March and April, and the second dose in May and June.
Phase 2, which will begin in May, will focus on essential workers such as public sector workers, hotel workers, and workers in the transportation sector. And the general population will be vaccinated in Phase 3 of the plan. Mr. Bryan says the vaccination process at the vaccination sites is divided into 5 stages.
What happens at our vaccination centers? Our vaccination centers has 5 stages: registration, counseling, vaccine administration, observation, and documentation. Now, each stage, we have done a time and motion calculation, and each stage of the process requires some time. So we're looking at a minimum throughput of 35 minutes with a maximum throughput of 52 minutes. Now, what makes the difference? The difference lies in stage 4. For those persons who have no history of allergic response, they will only be observed for 15 minutes. However, for those persons who have histories of allergic response, the recommendation is that they be observed for 30 minutes.
And Mr. Bryan says persons must set an appointment 5 days prior to being vaccinated.
If you wish to get an appointment, you must start the appointment process 5 days before you want your actual appointment. And when you ask for your appointment, you have to provide certain information: your age, date of birth, your area of work, comorbidity, your allergies, your address, the venue that you wish to be vaccinated at, your telephone number and email. Basic information that will guide us.
The ministry is aiming to have 65% of the population vaccinated by March 2022. Aisha Nation, Frontline News.